Welcome to the Coping Podcast, where we share strategies for coping with the stressors of life, especially the difficulties of parenting. And here is your host, Dr. Lee Weiss.
This is Dr. Lee Weiss. I am the host of the Coping Podcast, where I feature top experts on topics like raising healthy children, parenting, and so much more. Past guests include Dr. Doug Bolton, clinicians Ben Kessler and Michelle Winterstein, Dr. Aaron Fromm, and many more.
Just a quick disclaimer, the information provided is for educational and informational purposes only. This is not intended to provide mental health treatment and does not constitute a client-therapist relationship. The information provided is not a replacement for being assessed and evaluated by a licensed professional and is not intended to replace mental health or medical advice.
This episode is brought to you by Coping Partners. Coping Partners is a mental health practice in the Chicago suburbs dedicated to helping children, adolescents, and adults. We help manage various challenges, including anxiety, divorce, behavioral issues, relationship problems, and much more. Check out more episodes of our podcast and our website at copingpartners.com, and you can contact us with any questions you have. So before we dive into today's topic, I wanted to introduce our guest, Elyce Shapiro. Elyce is a licensed dietitian nutritionist, and the founder of Balanced Gut Nutrition and Health. She is deeply committed to the gut-brain connection. Elyce holds a master's in nutrition and integrative health and is a certified nutrition specialist and a health at every size practitioner. We'll explain later what that means. She supports individuals, often those experiencing stress, trauma, anxiety, or digestive issues, in restoring gut balance without diet culture, restriction, or weight stigma. Her virtual private practice specializes in helping individuals whose digestion is intertwined with emotional or psychological stress. Her website is balancedguthealth.com, and she offers virtual consultation sessions for adults. So thank you so much, Elyce, for being here.
Thank you for having me. I'm excited to be here.
Likewise. And before we even start, I have to just let you know, I loved the quote on your website. And for those listening and not watching, it says, "Your gut and your brain are besties, but sometimes besties can get out of sync." So I just thought that was like the greatest quote for the website in terms of what you do. But I'm going to let you start by just sharing a little bit about your background, kind of like what is it that you do and how did you get into this line of work?
Yeah, no, thank you. And that is, I often use that a lot when talking about the gut-brain connection, just because, I say sometimes they get out of sync. And just like if you are out of sync with your bestie, it kind of feels like your world is like done a complete 180 and you're thinking, oh my gosh, what can I do to bring things back to normal? And the same thing you would do with your friend is what you do with your gut and your brain is you have to support both. Mm-hmm. And so anyway, so that's kind of the little narrative about like what I do. But so I am a licensed dietitian nutritionist. I focus on gut health and its connection to mental health. And what that translates to is basically people who have digestive issues. And I'm talking about all those ones that people don't like to talk about, poop, gas, all that, stuff
Floating.
that we, yes, exactly. I like to say that I have a passion for poop. It is true. So yes, but so people who have all those digestive issues, and if they have stress or anxiety or PTSD from trauma or things like that, that can exacerbate your digestive issues. And also your digestive issues can make you anxious and they can perpetuate your mental health issues. And so I work to kind of break that cycle by addressing both of them, obviously within scope of practice from a mental health standpoint. And then in terms of like, what even brought me to this is I think everyone who gets into, a lot of people get into the integrative health field, it's, based on your own personal experiences. And so for me, I have a history of trauma and PTSD, as well as digestive issues. And it was through my own long path of going the conventional route, seeing different GI doctors here in Chicago, Northwestern, University of Chicago, Rush, and then also Cleveland Clinic and things like that. None of it getting better, took years. And then it was through me understanding becoming my own advocate, like I think so many people have to do.
Right.
And learning about gut health, reading articles about how our gut bacteria can impact specifically PTSD and trauma for me. And as a side note, also working with a therapist. That part is very important too. But from a digestive standpoint, when I learned about that, I wanted to learn how I could heal my gut in terms of gut bacteria. And so I saw a naturopath, and she was able to do in 6 weeks what doctors couldn't do in 6 years. And
Wow.
so, yeah, and that's nothing like I love conventional I mean, we need them. Like they
Of course.
brilliant. There's so much great medicine that we have out there, but also, there's room for other things too.
Absolutely.
So anyway, so yeah, that once I started to heal from everything, and full disclosure, I was working in corporate America, and I was making, I don't know if this is appropriate to say, but a whole bunch of old white men that were already rich, a lot richer, and learning how stress impacted my life. And I had to, be very mindful of that while still getting through the PTSD and all of that. It wasn't worth it. And so I quit my job and knew I wanted to go back to school to get a master's and do what I do. So,
oh, that's incredible.
yeah.
What an amazing story. And we're glad you did, because it sounds like you're helping a lot of people in an area that, again, is probably not so popular at this point. I don't know many people who do what you do. So that's wonderful.
Thank you. I love what I do. So
Well, you can tell anyone who's like, I love poop.
seriously, yes.
So what does gut health really mean? And kind of like what, I guess, what are things you advise patients to do to improve gut health? Let's start there.
Yeah. So it's a great question. And the answer is that it's different for everyone. Similar to ask, what is, if someone says they want to improve their health, it's different for everyone. So from a gut health perspective, typically the things that I'm seeing in my practice are people who have, frequent diarrhea or frequent constipation, gas, bloating, especially for women when they feel like that they can't wear their clothes because, if they unzip their pants because the bloating is so bad. And it's also a combination of having those digestive issues, but seeing how it's impacting them in their social life.
Mm-hmm.
So what I find in a lot of people with digestive issues is we get these socialization fears. So fears to go out to dinners with friends, or fears to go to parties or work events, because you don't know if the food that you're going to eat, is that going to make you run to the bathroom? Do you have to justify why you're running to the bathroom or how long you spent in the bathroom?
Right. That can be embarrassing, for sure.
Yeah, exactly. And so, so for me, it's, those are the types of people I think when we talk about improving gut health, it is so that they can improve their quality of life, so they don't have fears around, socialization or eliminating a ton of foods. When people have digestive issues, I find so many people are constantly removing things, trying to find, what is the food that's causing this disruption? And I will tell you, most of the time, it's not the food. But so for those people, it is food freedom. It's being able to eat what they want without fear. So I think it's really just improving their quality of life depending on how their digestion is impacted.
Right. Well, and I can say I work with a couple of young adults who have, diagnoses of IBS, and right, it impacts their mood, right? Like you're saying, they don't want to go out. They don't want to do the normal things they enjoy doing. They feel, often more anxious or more depressed. It definitely impacts, the mood. And so we always think about gut, we talk about gut like you have a gut feeling.
Yep, totally.
And, we think about gut like a second brain. And I do think it's sort of like a chicken egg, where sometimes it's hard to tell like which came first and which causes what. But, I've had patients who have anxiety who are treated with a medicine that's supposed to help their GI issues, and all of a sudden the anxiety gets better, and vice versa. So it's really a fascinating connection for me. And obviously for you, a heck of a lot about it. So maybe you could tell us a little bit about a client you've worked with, obviously not with a name or anything like that, but just kind of like what they were coming in for and what kind of work you did with them to improve these symptoms.
For sure. No, thank you. Yeah. So I've got one client, she was in her, well, we're no longer working together because she's in a good place now. But no, she came to me because she had just been has so many digestive issues for about 2 to 3 years. And it's the gas, the bloating. Full disclosure, I don't remember whether she's tended towards constipation or diarrhea at this point, one of the two. Yeah. But for her, she had also been put on, and this is one of the big misconceptions up there. So IBS, right, irritable bowel syndrome. A lot of people get that diagnosis, and it's really just an umbrella for, we know there's something wrong with you, but we're not really sure what it is. So we're going to put you in this category.
Right.
70% of IBS diagnoses are actually undiagnosed SIBO, which is something, SIBO, SIBO stands for small intestinal bacterial overgrowth. And I mentioned that because this is something that I suspected with my client based on her symptoms and things like that. And so what's interesting is that the GI doctors had told her you should follow a low FODMAP diet, because when they give them the IBS diagnosis, and again, this is not anything against GI doctors, they're doing what they, what they know and what they see. And I know that they don't get a ton of nutrition education, right? So totally understand that. And they'll put them on something called the low FODMAP diet. Low FODMAP diet, it's basically, FODMAP stands for fermentable oligosaccharides, like all these other saccharides, which are basically complex sugars, that when we eat certain complex sugars, that they break, our body breaks them down. Some people with digestive issues have a hard time breaking them down. The low FODMAP diet is extremely restrictive. I don't use it in my private practice. It does not treat anything. So it can maybe resolve the symptoms for about maybe a week or two, but ultimately it doesn't improve anything. It doesn't change the condition. And it's also not just extremely restrictive, but extremely nutrient poor. And she'd been following this diet.
Sustainable, you're saying, like for life, like you might do it temporarily to relieve your symptoms, but it's really not a good long-term plan.
No, it's also been known, anecdotally as a gateway to disordered eating, eating disorder. Yeah. So, what I'll say though is also from a gut health perspective, because this is usually a GI related thing, it deprives you of all of the foods that feed the beneficial bacteria in your gut. And so she'd been following this. If you put someone on the low FODMAP, we say short term, maybe 4 weeks, tops. And again, I don't use that in my practice, but that's what some of the guidance is. She'd been on it for 2 to 3 years.
Oh, wow.
So extremely restrictive eating. She couldn't stand it. It was driving her nuts.
Right.
She had so much anxiety about her food. She was still feeling horrible. Right. And same thing. She couldn't go out. She couldn't socialize. She was getting a master's in therapy, actually. And so, she just wanted that quality of life. She wanted to eat more. She was going to be taking trips overseas. And so we did this, I did an intake with her, kind of assessing everything. Turns out she had gotten some pretty bad food poisoning overseas. Incidentally, 2 to 3 years ago when her symptoms showed up.
Oh, wow.
Yeah. And so it was after that when all her GI symptoms started. So I ordered a SIBO test for her. I ordered a stool test, which in the state of Illinois, I do it through a third party, like legally, that's how we do it. And I can't diagnose. So if the SIBO test comes back positive, I have to refer her to the doctor for the formal diagnosis. The point is, we figured out she had some dysbiosis, which is overgrowth of unfriendly microbes. You don't have enough of the friendlies, too many of the unfriendlies. And we did, I gave her options. There's the conventional route you can go with antibiotics and things like that. You can also go herbal route. And she chose the herbal route. And so we did that. I didn't change anything in her diet. I told her she can eat whatever she wants because it's not the food. It's, she's got this overgrowth. She also had some intestinal permeability, which is basically when the lining in our gut, we have this very thin lining in our guts, quite literally 1 cell thin, very protective barrier. And if it gets opened, all the stuff from our digestive tract leaks into our bloodstream. And it's known as leaky gut. That's the term everybody knows it by. I call it intestinal permeability because I had a professor in grad school who hated the term leaky gut. But same thing. Point is, when that happens, it's not the specific foods that you're reacting to. It's the fact that you have your gut lining isn't where it should be. You've got food and all these other particles leaking into bloodstream, which creates inflammation.
Mhm.
So we just needed to heal her gut, and she doesn't need me anymore. She travels,
So, and when you say she went the herbal route,
yeah.
right? What does that mean? Like, what is she actually taking?
Yeah, great question. It's a bunch of, I mean, honestly, it's a bunch of supplements.
Okay.
So there's certain herbs that have antimicrobial properties. And so we'll use those. We'll use certain nutrients that are really healing to the gut and support the gut lining
Wow.
to help, reinforce that. So yeah, it's a bunch of like herbs and spices that,
Wow. And
yeah.
then after how long would you say you saw this turnaround where she was feeling much better?
I mean, the thing
I mean,
is,
from the time she started the herbal, kind of treatment.
yeah, that's the thing. And I always, this is why I give my clients the option because the herbal route takes a lot longer. We're talking like maybe 6 months, if not
Okay.
longer,
Okay.
on a gut
But
protocol.
she'd had years of pain and
Yes,
suffering. So, I mean, and then how long would like the antibiotic route take?
2 to 4 weeks, depending on what they put you on.
Okay. But it,
Um,
but
yeah,
it, what are the cons of that route? I'm assuming there's also cons to that.
there are cons to that in that because antibiotics are not selective, they kill everything, the good and the
The
bad.
good and the bad.
But full disclosure, some of the antimicrobials that we use too, they also do that. So I will reinforce, we're doing some, getting rid of some of the overgrowth, but also do stuff to reinforce and provide, for the fact that we are getting rid of some of the overgrowth and maybe killing some of the good, which I could do the same with antibiotics too.
Right.
I
So if
let them
someone's
know that.
working with
So
you and they choose to go like the more
yeah,
conventional antibiotic route, you
yep,
would still help them in terms of like what should you be making sure, I'm assuming probiotics or something like that to make sure that while you're doing the antibiotics,
yes.
you're kind of helping them heal still.
Yes, exactly. So yeah, and also some people just prefer, I know we're in this era of like holistic health, and that is a field I work in, but sometimes I do think we take it a little too far. But the more natural approach, some people just don't like the thought of using antibiotics, so
Right.
fully
Right.
support
It sounds like there are two alternatives. Right.
it. Yeah,
Exactly.
exactly. So
But it sounds like you're very helpful too in helping a client who's had these symptoms for years and years, even understand how to get the right diagnosis. Where
yeah,
it sounds
that's
like,
yeah,
conventional medicine, like you said, often just it falls under an umbrella. And there's, I mean, I've clients again who are in their 20s who've had major GI issues for years. They have GI doctors, and I don't know how much better they're feeling. So this is really
yeah,
helpful information.
yeah.
Tell
Thanks.
us a little bit about like from a parenting lens, right? I know you work with adults, but from a parenting lens, kind of what should we do in terms of our kids' gut health from an early age? Like, or what should we do and what should we not do, I should say.
Yeah, it's a great question. And so, one of the things I think for kiddos, and this also comes from my health at every size lens, which, just as a quick description, that basically means I take a weight neutral approach. I don't use weight as a marker of health. I think we have an extremely fat phobic society. Not even, I know we have a fat phobic society, diet culture that tells us that we need to be a certain body size or weight to be respected. And I don't support that in any way. But it also means practicing food neutrality. There are no good or bad foods.
Mhm.
Pizza and ice cream, they all have their place. And as someone who focuses on gut health, I can tell you, I still have no problem with kiddo. Try to take away a kiddo from eating pizza or ice cream, especially like at a birthday party or something. Like it's just,
Yeah.
no. And so, practice food neutrality and also taking an additive approach to what people eat versus taking away. So, like, I would say, again, I'm not a parent myself, but what I do kind of recommend is focusing on increasing their intake of some of those, nourishing foods.
Mhm.
Whatever kiddos like, every little bit counts, and just not almost like trying to not be too perfect about it, not focusing on, oh my gosh, they're eating French fries and they're eating burgers. And you know what? There's nourishment to that. There's joy in that.
Right.
Um, you don't want to create a negative relationship or association with food.
Mhm.
Um,
So
and
not to
so,
get carried away, it sounds like is one of your messages
yeah,
because again, sometimes parents are really healthy,
yeah,
and like it's changed their lives. And so they want their children to, kind of have the same approach to eating, but it's scary because food is something that only the person eating really has control over. So you're saying kind of let them be kids, let them eat some unhealthy foods, but your goal would be more to introduce some of those foods that they like that are healthy and make sure they have those. Are there certain foods that are particularly gut healthy foods? Again, this is a new concept to me.
It's a good question. The key when it comes to foods and gut health, diversity.
Okay.
You want to eat our gut loves colors. It loves diversity. It's like, I love, I have this weird thing that I eat all year round, being in Chicago, frozen blueberries, frozen pomegranate seeds, and frozen mango. I love that. However, if I ate that all day, every day, yes, that's great fiber. It's so many great nutrients. I should eat oranges. I should eat potatoes. I should get cheese. You want to have a diverse group of foods. So it is really like introducing new things, trying new things. And I know for some people that's hard because we get in those routines. Some people have the same thing for breakfast every day.
Right. But you're saying if at all possible, especially again from like a parenting lens, introduce kids to different foods. For picky eaters, don't just give in to they only eat macaroni and cheese all day long. Like continue to introduce new foods and so forth.
Yeah, that's the number one tip that I always talk about is diversity, getting movement, getting sleep. Movement is actually really good to support your gut health. Sleep is when our digestive system resets, just as how our brain resets.
Yes.
That regulates our blood sugar, our hunger and satiety hormones. Those get, supported when we sleep. So, really, it does go back to all the things that you would do to support your health overall.
Right. Also help with your gut health. That's awesome. I should say, by the way, as a side note to listeners, we're talking about some of the things that parents can do around their kids eating. But, part of the reason I wanted Elyce to come on the podcast was that we are kind of working with parents also on self-care. I just interviewed someone on friendships, like meaning adult friendships. So it's not just about the parenting lens. It's also about taking care of your own self and your own body. And when you're not feeling well as a parent, when you have major, like you said, stomach pains, bloating, constipation, it's going to affect your whole world, including, how you parent and how you feel. Yeah. So I'm glad again that you can kind of speak to both lenses, but this is so important for everyone.
Totally. No, thank you. I appreciate that. And then, also just normalizing the conversations around those, typically taboo topics, not being afraid to ask your kid about their poop, asking them, what does it look like? What is, shape does, or asking them, like if they're saying their tummy hurts, what does that mean? My adult clients, I have to really drill into that when they say, oh, my stomach was so upset. And it's usually like having to be like, okay, well, what does that mean? Oh my God, I was going to the bathroom.
Because they're uncomfortable talking about it, right?
Yeah. Yeah. So just normalizing those and make it okay. Like in my client sessions, I will openly talk about, when I had diarrhea or whatever, because it's a normal thing. There shouldn't be shame around it. And if my clients have to open up to me about, or not have to, but it's helpful for them.
Sure. Yeah. No, that's a really good point. Because again, a lot of people's stomach hurts, right? For totally different reasons. And is it like my stomach hurts because I'm anxious about the test today? Yeah. Or is it my stomach hurts, constantly and I am completely bloated and I haven't pooped in a week? Very different things.
Right. Exactly. Exactly.
Yeah.
Totally.
I love that little book, Everybody Poops. I'm sure you have that for you've seen that one. There should be an adult version of it. If you haven't made it yourself, you could write the adult version of Everybody Poops.
Thank you. I don't know if you saw that's actually on my website. There's a picture of me reading that book.
Oh my God. No, I didn't.
I love that you mentioned that because that is me in a nutshell. Because I am reading poop research all day. I am talking about poop with my clients. I'm talking about it with my colleagues. It is, so I love that.
And it's actually funny. So again, the couple women clients that I've been alluding to who I adore, who are in their 20s and have some serious GI issues, they will say to me, is it okay, Dr. Lee, can I tell you something about my poop? They'll literally say that. And I'm like, of course, you could tell me anything. And then they'll go, haven't pooped in, and they'll tell me, and I've been taking Miralax and it's not enough. And so, I'm like thrilled that they feel like they can talk to me about it, but it's such a taboo topic that they even in their private therapy have to say like, is it okay? Are you comfortable?
Right.
Yeah.
There's so much poop shame. And so I try to remove that stigma and that shame around it.
Oh,
So
I love it. I
yeah.
love it. So
Yes.
tell us a little bit about, I guess, sort of like the stress gut reaction, kind of maybe in the opposite, like how does stress impact gut health?
Yeah, it's a great question. So I'm sure you're familiar with the vagus nerve and the role of the vagus nerve, but for the parents and everyone listening, our vagus nerve is basically what connects our gut and our brain, and it's how they talk to each other. And it's actually one of the longest nerves in the body. And so our vagus nerve taps into our parasympathetic, which is our rest and digest system. And so oftentimes when we like if someone is stuck in fight or flight or freeze, we know they're in sympathetic mode. And the way I explain it too to people is it's sympathetic, which is our fight or flight, and then the rest and digest is parasympathetic. They're like a seesaw. So you can't be in both at the same time. You can be in one or the other.
Okay.
And if we stay in sympathetic dominance, so we're, that fight or flight, it has a number of impacts. So that's like there's stress, the anxiety, things like that. First of all, we don't know why, but what we do know is that anxiety and depression and a number of other mental health conditions, we see a shift in the microbes in someone's gut. Like we see less of the beneficial bacteria and more of the inflammatory bacteria. Not sure why. The gut bacteria research we've come a long way in the last 10 years, but we still have a long way to go. But it's interesting. So you'll see we get less of the helpful beneficial ones, which kind of creates this cascade effect of if you don't have enough of beneficial, it can perpetuate some of the mental health issues.
Wow.
Yeah. And then also, again, if we're stuck in fight or flight mode, or we have that anxiety, that's an upregulated HPA axis, right? The hypothalamic pituitary adrenal, which is our stress response. The HPA axis puts out cortisol.
Mm-hmm.
That cortisol can be an annoying little bugger. Cortisol, so again, we'll see more cortisol with mental health issues. And so that is it compromises the integrity of our gut barrier. I talked about how our gut barrier is so important to prevent intestinal permeability. Cortisol is basically like a battering ram to our gut barrier. So it just, it eats away at it. And so it can increase chances of intestinal permeability. When we have intestinal permeability, so when stuff is leaking from our gut into our bloodstream, that creates inflammation. Inflammation, because it's in our bloodstream, that becomes systemic. It can make its way up to the brain. And, there's the blood-brain barrier. So when we see more inflammation in the brain, you'll see increased brain fog. You'll see increased fatigue. You'll see increased, mood disorders, things like that, neuroinflammation. So that's, those are some of the ways. I'm trying to think of other things.
And we know that stress, right? Stress is bad for our health, right? Everybody knows that. And it's so funny because then my anxious clients go like, oh, but now more stress because now I'm really, really bad. Like we got to just breathe, but it's true that, we try to have people work on relaxation and self-care and kind of like, how are you handling your stress? Are you walking? Are you exercising? Are you eating right? Are you sleeping because you're drinking water? Because
totally.
Obviously we definitely know there's a significant impact for sure.
Yeah. And one of the things that I also talk about too with my clients and also when I'm talking to therapists is, right, it would be so lovely if we could tell everyone just to get rid of your stress. If everyone could get rid of their stress, not likely, especially people with trauma, PTSD, things like that. So it's more the acceptance of it and just saying, okay, I know I'm stressed, but not beating yourself up over it, right? Not stressing out about your stress and that acceptance part of it. Because even those are like the little glimmers, right? Like from like the polyvagal theory thing of, just tapping into your parasympathetic nervous system, even just for a little bit. That counts. So really just accepting that this is okay. It's okay that I'm anxious. It's okay, like this is just where my body's at. So let me lean into it. So
Right, absolutely.
yeah.
When you're working with adults, are you typically working in conjunction with a therapist? Because it sounds like often there's the GI issues and it sounds like mental health issues like anxiety, for example.
Oh yes, quite literally every single one of my clients has a
Okay.
therapist. And they don't, yeah, it's not a requirement. And I will obviously honor and respect everyone's comfort level, but inevitably at some point, yes, right now my client roster, everyone is working with a therapist.
That's wonderful. No, because I just think, like you're saying, it's a two-way, the gut
Totally.
brain is like a two-way texting
Yeah.
street. I can't speak street.
Yeah.
And it's like you might as well really tackle both ends and see what you can do together. And I would
Totally.
imagine that is probably you're probably seeing better outcomes when it's tackled from both sides, from both
It
angles.
is. And then there's the collaboration. Like a lot of times I'll collaborate with the therapist. So we're kind of talking about with the client's permission, of
Yes,
course.
of course.
But just, like here's what I'm doing, so it's a better outcome overall for the client.
Absolutely.
Yeah.
And one other thing I'm struck by is when you were saying movement helps, right, with the
Yes.
GI. I mean,
Yeah.
again, I think most people can like remember a time when they've had a really bad stomach ache and you want to like clench up, but if you take a walk or something, it really does help.
Yeah.
But it's interesting because that's always one of the things we tell people who are having, mood issues that like you got to move your body. You may
Yes.
want to curl up in bed and do nothing. And like
Yeah.
we know it, especially if you're like breaking a sweat, if you're able to go on a jog or something, that it acts in the brain like an antidepressant, right? And so
Absolutely.
exercise, cardiovascular exercise. So it's just interesting hearing that some of the same interventions are
Mhm.
helpful for both, GI and mood, which makes
Yeah.
sense.
Yeah.
But it's just kind of helpful to hear that out loud.
No, I love it. And I love that you talked about it that way because it's so true. And that's why, I'm not a therapist, but some of the things like the movement, like you recommended, I recommended. And so
Absolutely. So
that's so
interesting.
many
So
beneficial
it really
effects.
goes together. Yeah.
Yeah.
I would say, what else? Any other tips that you'd like to share with us about things that the everyday person can do to help with GI health,
Yeah.
that we haven't mentioned so far?
Yeah. I think instead of what to do, what not to do.
Okay.
I know if people look up, if they want to support their gut health and they Google it, the three things that are going to come up are probiotics, fiber, and fermented food. Those things are not wrong. Those
Okay.
things can be very beneficial for gut health. And if you have GI issues and we don't know what's going on in particular, those things can make it a lot worse. So probiotics in particular, anyone who has a compromised immune system, first of all, we'd never recommend probiotics for them. If someone does have SIBO, which is what I mentioned before, probiotics can make it worse. In fact, in the protocols that I will do, and protocols meaning just my recommendations, there's no like standard protocol, everything's different for everyone. But in my gut protocols, I very rarely will use a probiotic in the beginning. I will maybe use it at the end. I actually wrote a newsletter kind of like, because I get asked about this a lot. When people, want to fix their gut health, when you add a probiotic, it's because you're adding more beneficial bacteria. Oftentimes for people, their gut issues are not because they don't have enough beneficial. There's other things going on.
Yeah.
Um, so I would say, use caution about like maybe work with a provider before looking to do that.
Right.
Fiber, fermented foods, same thing. If you've got a person with IBS who tends towards diarrhea and you tell them to take fiber, oof, they're not going to come back. Um, like it's just, I go, there's a specific fiber I'll use with my IBS clients and low and slow, and
Yeah.
only after we've done some other things to support their gut health. Same thing with fermented foods. They're great for natural sources of probiotics, but some people just can't do them and it's going to make it worse. So
Right. Oh,
those
that's
would be
so
my
fascinating. Yeah. No,
everything. Yeah.
that's super helpful. It just kind of goes back to, if you're struggling with this, you shouldn't kind of like be figuring this out on your own Googling. You
Yeah.
should really see someone like you who really knows what
Yeah.
they're doing and is reading the literature. And it sounds like you were again working in conjunction as you need to with the
Yeah.
GI doctors, sometimes for these
Totally.
diagnoses that you might have a suspicion. I think it's this, but
Yep.
the official diagnosis and kind of like then come back to you for the treatment protocol options.
Yeah, exactly. Like if they need antibiotics, I can't prescribe that. So they need to get it from their doctor.
Right. Right.
Yeah.
But no, it sounds like your approach is really, again, holistic, and you really get it from personal experience. You have a degree now, you have been doing this professionally, like, right? And so it's better to not figuring this out on your own.
Yeah. Thank you. Yeah.
I was just going to say my last question is just if you have any specific resources, whether they're books or articles that you think are good for parents or again, adults, I should say, who just want to learn more about this topic because they might have struggled with GI issues their whole life.
Yeah, for sure. First of all, my heart goes out to anybody who has been struggling. I know personally and professionally how changing that can be for your life.
Yeah.
So I'm probably not the best person to ask in terms of resources. So fun fact, don't have any social media.
Okay.
I spend my life living in PubMed research. I have listened to podcasts. I have read some of these books, and I think that they're interesting. They're usually more subject matter experts. Most of the podcasts that I listen to, usually about like, I don't know, 40% of the material, I'm like, okay, I agree with this, but then the rest of it, I don't. So I would more just recommend maybe finding someone, who specializes in that area to get advice from them. Please don't get advice from influencers.
Yeah.
They are not qualified to be giving health advice, and take the books. Like there are, books that I've read from experts in the field. And most of that
one size fits all. Like it's not an individualized thing.
Exactly.
Yeah.
And then only other thing that I did just want to mention as a plug,
Yes.
particularly for kiddos, especially young ones, what I have learned. So I work for this company as a part-time position, as a microbiome analyst, because as much as I love poop, I thought, let me dive into a company that does stool testing for little kiddos. And it's a company called Tiny Health, and they're the only company on the market that actually does stool testing for kids anywhere from 0 to like 3 years of age. Because after 3 years, your gut takes the shape of an adult gut. But those first 1,000 days, you can do a lot, particularly if you see them with eczema. It turns out there's some pretty simple things we can do to help prevent that atopic march, which is the food allergies, the rhinitis, the asthma, things like that tend to be more prominent in those earlier ages. And so I did just want to mention that if anyone is interested, there are things you can do to help your young ones out too. So.
That's an amazing resource. I have a friend whose daughter has significant asthma and allergies.
Yeah.
And the mother was telling me actually that as a baby, when this girl was a baby, the mother, my friend, was hysterical because she would be having constant diarrhea and just terrible. She'd bust through every diaper, for years. And so it sounds like she would have been the perfect candidate for this. So I am going to keep this in mind for people with young, 0 to 3. Like you have to get it when they're little and you notice it. But that's really helpful information. So thank you, Elyce, so much for sharing your time and your expertise with us. I really appreciate it.
Thank you for having me. This is fun. And I could nerd out talking about this all day. So thank you for the great questions. And yes, just thank you so much.
I love it. And everyone, check out more episodes of our podcast. Go to copingpartners.com and click on podcast and articles. We will have all of Elyce Shapiro's contact information listed. And thank you, as always, for tuning in.
Thank you for listening to the Coping Podcast. We'll see you again next time. And be sure to click subscribe to get future episodes. And check out our podcast page at copingpartners.com.